and welcome to The Vaccine. I'm Jeremy Fernandez. New South Wales has declared its COVID surge a national emergency as Victoria, South Australia and now Queensland continue to battle the Delta outbreak that originated in Sydney. Coming up, a look at the pathway out of this as more than half the population endures lockdowns and restrictions and vaccinations slowly ramp up. Plus, we take a look at the new centre of the coronavirus outbreak, Indonesia. Australia's largest neighbour is struggling to cope with a surge of cases and deaths. But first, New South Wales authorities have called for a drastic change to the national vaccination drive. The state wants doses from elsewhere to be redirected to southwestern Sydney, where case numbers are continuing to grow. It also wants younger workers from that part of the city to be given the Pfizer jab to stop the spread. Under 40s in New South Wales are currently not eligible for a shot unless they have an exemption.
The key to our freedom, the key to us living freely and as openly as possible is getting more jabs in arms and containing the virus and not allowing it to spread further.
The goal has not changed. Suppression is the primary tool to achieve that, and vaccines can help that. To that end, we discussed and will be confirming over the next 24 hours the ability for in New South Wales, in their state vaccine centres, for them to do greater amounts of first doses by staying within the medical advice, the ATAGI advice, which says that second doses of Pfizer can be extended out to 6 weeks. So that is an existing regulation, it is an existing approval, it is an existing medical advice. So to increase the amount of first doses that can be delivered, maximising greater the supply we have available, then we're working to put that in place in New South Wales because of the situation that exists there.
So more Sydney-siders are also being banned from leaving their local government area. The restrictions are now expanding to take in people in Cumberland and Blacktown, in addition to Fairfield, Liverpool and Canterbury Bankstown. But the Victorian Premier, Daniel Andrews, says that's not nearly enough.
We need a ring of steel around Sydney so that this virus is not spreading into other parts of our nation. Let's focus on fixing what's going on in Sydney. Let's focus on not spreading what's going on in Sydney across the rest of our country. We will finish up with the whole country locked down if we don't do this properly.
The only view that matters on this is the view of the New South Wales Premier, because they're responsible for how they manage the lockdown in New South Wales. There's nothing light about the lockdown in Sydney, I can assure you. My family are in it.
Let's go to Casey Briggs now with the latest figures. Casey?
Yeah, hi Jeremy. Well, it doesn't take an expert to see that the trend at the moment in Sydney is not our friend. We've got 14 people now on ventilators in New South Wales with COVID-19 out of 130 or more people currently in hospital. And on Friday, a new peak, 136 new local cases, and the trend line, well, it's going in the wrong direction. More than 100 cases firmly on average every single day being recorded across New South Wales. And the number of cases out in the community, while infectious, that's growing in the wrong direction. So the one good thing that we're seeing is really high testing levels. 3 days in a row with record numbers of tests recorded. And the per capita testing rates in Liverpool, Fairfield and the Canterbury Bankstown councils, they are very high, partly driven by some of that routine testing done of workers leaving the area, symptomless workers turning up some of those undetected chains of transmission. So the cases, and that area, that Western Sydney area, that's where most of the cases have been. Cases in those Western Sydney hotspots are relatively flat at the moment, perhaps starting to recede, but not fast enough, because this is the growing spillover into other parts of Sydney, particularly the Blacktown and the Cumberland councils, and that's why we're seeing the catchment where those tough rules have been applying grow to include those two council areas as well. And from the way that Dr Chant's talking, it sounds like that might just be step one in some more new rules coming for the city. For example, Dr Chant was talking about whether there needs to be more done to support people to stay home. Does that perhaps mean paying people who don't have sick leave to go into isolation? Across the rest of the country, we've got, relatively good numbers stepping in the correct direction in both Victoria and South Australia. There aren't any major concerns there at the moment. We just need to see those numbers get back down to zero. But another reminder of just how precarious this situation we're all in is right now in Queensland, with one case found in a flight attendant in the Delta strain as well. And that flight attendant has been all across regional Queensland, Longreach, Hervey Bay, and also Gladstone. So another good reminder there of just the situation that we're in at the moment and how rocky these next few months will be, even without the New South Wales outbreak.
Casey, thank you. Dr Norman Swan joins us now. Norman, the case numbers in New South Wales are not moving in the right direction. The New South Wales government is resisting any harder lockdown. So on the current trajectory, where does this leave Sydney and the rest of the country?
Well, it potentially leaves Sydney without any bending of the curve. That's not a prediction, but it's actually something that we've got to have a conversation about, is what if they don't bend the curve? Because they are not going hard and fast. They are still doing progressive increases. And we saw in Victoria last year that just shutting down individual LGAs does not work. The virus is all over the city, and we still don't have a citywide full stage 4 lockdown. It's not far off it, but the sort of restrictions you're seeing on those suburbs probably need to be applied to the whole city. And I say that as somebody who lives in Sydney. So we have to be prepared for the possibility that they don't change this, and that we're living with a stable but growing number of cases, as Casey showed us, which is just slow growth of cases each day, and it doesn't change, which means we're on a knife edge. New South Wales is locked away from the rest of Australia. What do we do? And we've got to start talking about that. They're talking about ramping up vaccinations, seeing if we can take vaccine from other states. Kerry Chant was talking about something I was talking about on the vaccine last time I was on, which is extending the dose between Pfizer doses to allow you to get maximum number of doses out there, not worry too much about the second dose, because that will come in time and protect as many people as possible. It's an idea of Professor Terry Nolan at the University of Melbourne. And more use of rapid antigen tests. We could actually be the amount of time that people is waiting for tests at the moment is really quite extraordinary at times. We could actually be using rapid antigen testing, for example, for the workers who need to go to work sites. We might be able to open up construction sooner, that you don't just get on a work site with a helmet, a high-vis vest and a pair of boots. You've actually got to, on-site, have a rapid antigen test to prove that you're negative. If you do that every day, it's really quite accurate. Not a replacement for PCR, but it could unload the system and allow people to get back to work. We've got to work out how we actually live through this until we get to 80% coverage of immunisation.
So why are those rapid tests not more widespread right now in the middle of this crisis?
The pathology industry is down on them. They say that they're less accurate. I did a story for RM Breakfast, which people can look at on the overseas research. The overseas research is pretty solid on this. It's when you're infectious and when you do them regularly, they're highly accurate. They're not as accurate when just before you become infectious, and they're not as accurate after the high infectious period. But that's a time when PCR picks up false positives where you're not really infectious after the event. But if you're doing them regularly on groups of workers like airline workers, construction workers, office workers, and you're doing them every day, they cost $10 to $15 each. You get the result in 15 to 30 minutes, and it really does sift out the people who are actively infectious, and we should really be thinking about it.
Daniel Andrews is now talking about a ring of steel around Sydney from an epidemiological point of view. Does that make sense?
Well, cutting down travel and cutting down movement is what will bend this curve, if anything's going to bend it. And if you've got people getting out into regional New South Wales and by implication elsewhere, then you're running the risk that it spreads. People have got to stay home. It's painful, it's terrible, it's awful for the economy, but it's the only thing that works. Social distancing, in the absence of vaccination in large numbers, is the only thing that works. And we don't have vaccination in large enough numbers yet to make a difference.
Speaking of vaccinations, the recommendations have expanded to take in more people, younger people, children. How significant is that?
Highly significant. We need to be, in the first instance, immunising down to 12 years old. because unless we get to 80% of the whole population, we're not going to have herd immunity or be really resistant to this. So we are going to have to use Pfizer down to the age of 12, and we are going to have to immunize children. And we've got to prove that the vaccines are safe, so we've got to wait on the clinical trials there. Highly likely it will be, but we've just got to make sure that we are protecting our children. But at the moment, for example, in Britain, where they're letting it rip, children are highly exposed to this. We've had hundreds of thousands of children in Britain staying home. Some of those will get long COVID. They don't get seriously ill, but this virus will just move down and it will progressively become a childhood disease. We've got to protect our children.
How is the vaccination drive going? Are we going to get to that timeline of reaching most people being vaccinated by the end of the year?
I hope so. We should have the vaccine by then. It's great that we're getting up to 200,000 doses a day. But we need to be at 300,000 or 400,000 doses a day. We're not there yet. And I hear from the inside that Lieutenant General Fruin is a bit frustrated with the Department of Health about actually opening up new avenues there. But hopefully we can, and we get those jabs into people's arms. Pharmacists are going to be really good for this. We've really got to outreach to disadvantaged communities, people where English is not a first language, who don't necessarily have their own general practitioner. We've really got to find every way possible to get vaccine out. Pharmacists will be very important for this.
Norman Swan, thank you.
You're welcome.
Well, Indonesia is among the world's worst hotspots. Officially, there have been more than 3 million cases recorded and 76,000 deaths. But there are fears the actual numbers could be a lot higher. In one day alone this week, more than 49,000 people tested positive to the virus and 1,500 died. It's left gravediggers overwhelmed while the country's hospital system continues to buckle under the pressure. Health workers are among those dying despite being given the Chinese-developed Sinovac vaccine. Diki Budiman is an epidemiologist who's spent 2 decades working with and advising the Indonesian government. He joins us now from Brisbane. Now, you don't think lockdowns in Indonesia, given the scale of the crisis, are a good idea. Why is that?
The majority of Indonesian workers is informal workers, and they have to earn the money and go outside. They cannot stay at home. Since the beginning of pandemic, I told that we have to use this lockdown intervention wisely. And that's why we have to, since the beginning of pandemic, we have to choose the most cost-effective strategy, which is testing, tracing, and then followed by the isolation and quarantine.
There are also limits to testing and tracing, aren't there? I mean, for most Indonesians, it's expensive and not widely available.
Yes, unfortunately, the government chose to have this passive regime testing, which is only the one who has the symptom come to the healthcare facility and they will get this testing for free. Regulation also require the population when they have to go, they have to also get this testing and they have to pay. And this is also another burden for community because not all of them has enough money to do this, every time they have the activity. And of course, again, in terms of public health strategy, this is also not a good choice because then our testing capacity will be very limited.
Dr. Budiman, why is it that Indonesians who are vaccinated with 2 shots are still dying from coronavirus?
The majority of healthcare workers, let's say, is already they are fully vaccinated even since during January and February this year. So, but then we saw after 6 months of this fully vaccinated, they got this fully vaccinated. It seemed the Sinovac vaccine is reducing their efficacy, effectiveness, and then also regarding the Delta variant. We see that seems the Sinovac vaccine less effective against the Delta variant. So that's why even since 1st of July until 17th of July, we saw around 114 medical doctors die due to the COVID. And half of them, 50% of them are fully vaccinated.
Dr. Budiman, thank you for joining us. And that is the vaccine for this week. You can catch up with the show anytime on iView and the ABC's YouTube channel. And if you're in one of the states battling these outbreaks, don't forget to check the exposure sites. Stay safe. Bye for now.